What is childhood obesity? Childhood obesity is defined as body mass index, or BMI, specifically for age and sex at or above the 95th percentile, as defined by the Centers for Disease Control and Prevention growth charts. Childhood obesity is a national and local problem. Approximately 17% of children and adolescents ages 2 to 19 years old are obese. As of 2013, 13% of high school students in Michigan were considered obese. 14.8% of children in Michigan ages 10 to 17 years old are considered obese, and as of 2011, 13.2% of 2 to 4-year-olds from low-income families were obese. There are multiple health effects related to childhood obesity, including cardiovascular risk factors such as high blood pressure or cholesterol. Adolescents are more likely to have prediabetes, putting them at high risk of developing diabetes, and they're more likely to develop sleep apnea, bone and joint problems, social and psychological problems such as poor self-esteem. And long-term effects are more likely to become obese as adults. This increases their risk of health conditions such as heart disease, diabetes, stroke, cancers, and osteoarthritis. What is contributing to childhood obesity? Poor eating habits, including more processed and fast foods. Lack of nutritious options at schools, including vending machines with soda and sugary drinks. Poor exercise habits through increased TV watching, gaming, texting, and playing on computers, and lack of physical education and activity. Facts related to lack of physical education and activity include only 1 in 3 children are physically active every day. Physical activity decreases as children age. And as of 2013, 15.2% of high school students have not participated in at least 60 minutes of physical activity on any of the 7 previous days from a self-reported survey. Only 58.8% of children ages 6 to 17 years old get vigorous physical activity more than 4 days a week. What are the recommendations for regular physical activity amongst children? According to the U.S. Department of Health and Human Services, young people aged 6 to 17 years old are recommended to participate in at least 60 minutes of physical activity daily. Schools can promote this through recess, classroom-based physical activity, intramural clubs, interscholastic sports, and physical education. Why are children not getting enough physical activity at schools in Michigan? Marcia Meyerhoff, a physical education teacher for over 20 years, and Fred LeGros, a physical education teacher for over a decade, both provide their insight on this issue. They answered the question, what has changed in requirements for physical education at schools over the years? What we have noticed is that we're having less frequency with our students, that we used to see them more often, and developing habits takes time, and so that has changed. We had our swim program cut. Michigan is a lake-surrounded state, and swimming is very important, and that was one of our favorite units actually, but because of the budget, our swim program was cut. And we've also had teachers retire, and then they didn't hire a replacement, but rather took the remaining teachers and divided them and had them cover more than one building.
Yeah, and as an example of that, I teach here at the 5th and 6th grade building 4 days a week, but I travel to the 3rd and 4th grade building on Thursdays to fill that gap, since they didn't rehire a teacher when our previous 3rd and 4th grade teacher retired. And because I travel there on Thursdays, now my students don't have class on Thursday. They used to have class 5 days a week for an entire quarter before we'd rotate to a new focus class. But now they have class 4 days a week, and the gym is empty on the day that I travel over to the 3rd and 4th grade. So frequency has definitely been lost, and we really feel that, especially at the elementary level, that frequency and building the habits, that foundation, is a very important piece.
They also answered the question, how do you feel this has impacted children regarding their weight and overall health? We do feel that it has impacted their health, and we've seen a rise in obesity, we've seen lower fitness levels, we've witnessed struggling students with motor skill development.
As well as the current concerns, especially a lack in motor development when 5th and 6th graders, we feel, have been a little behind, but the future is what concerns me as well, because if students aren't competent in motor skill development, if they don't have confidence to go join opportunities in school or out of school, that could have an impact on their health in the future as well.
So how can we help combat childhood obesity in Michigan? By passing Michigan House Bill number 5196. What will this bill require of Michigan schools? Some of the key points will be grades K through 5 will have at least 30 minutes of physical education at least 2 days a week for the whole school year, plus 60 additional minutes of physical activity during the week throughout the school year. Also, grades 6th through 8th will be provided at least 45 minutes of physical education every school day for at least one semester. Class sizes for physical education will be consistent with class sizes from other subjects. Guidelines consistent with physical education standards, grade level expectations, state board policy in education, and best available scientific evidence concerning physical education will be incorporated. And public schools will not credit pupils' participation in extracurricular athletics or other activities as meeting the physical education requirement. Marcia and Fred were asked their thoughts on Michigan's House Bill 5196. We do know that administrators, that superintendents will look at what the law is when they need to make some budgetary decisions, and so it's important to have something in writing.
Our focus in this discussion has been a lot about frequency, and I have a book called Spark here, and it's the revolutionary new science of exercise in the brain. And the book is actually based out of Naperville, Illinois, and Dr. Rady, who wrote this book, says right here on page 7, I want to cement the idea that exercise has a profound impact on cognitive abilities and mental health. And what they found in Naperville is, since they've implemented everyday physical education, and even like a 0 hour before school, students that go to their first hour class after that 0 hour have increased test scores. And there's been several studies that suggest the idea that our brain functions at its best after exercise, and so having daily physical education or high frequency in physical education can also help cognitively in the classroom in terms of test scores as well.
There are a variety of changes that need to be made regarding physical education requirements in schools. Michigan House Bill 5196 can help lead these necessary changes. So what can you do? Write the Michigan House Representatives to pass Bill 5916. Help us fight childhood obesity in Michigan by supporting physical activity and education in schools, instead of allowing poor exercise habits and lack of physical activity and education in schools to continue.